Great, so we have everybody here, so we'll get started. So welcome everybody to our webinar today. It's called PEI Food Premise Guidelines and Setting Up Safe Workplaces. So this webinar is really meant to complement the webinar that Ryan Neal and Chris Jones from Tourism PEI did last week on setting up your operations plans. And this goes specifically in for food service, and it is meant for a place for you to be able to ask questions. We have some really great experts here and people that are going through this right now and can kind of work through some of the practical nuances that you see when you're setting up and working through the guidelines. I'm Kent Thompson. I'm the Director of Finance and Food Tourism with Food Island Partnership. And the series of webinars has been presented by the Forage PEI Committee. So the committee is an industry group that we've come together, and around the middle of April, we recognized, okay, it's time to stop waiting and watching, and it's time to start moving into getting ready and being prepared for when things open. And how do we work together as a community to keep our industry together, keep it working together on any issues and thriving, so we're continuing to be Canada's Food Island. The webinar will be recorded, so if you have to step out for a second, know that you can join back, and tomorrow will be sent to you as a link. And we do encourage questions, so there's a questions link to the right there. If you wanted to submit any questions, I'll be sending those along to Tracy to ask our panel. So without further ado, I'd pass it along to Tracy Singleton, is one of the co-chairs of the Forage PEI Committee and owner and president of Versatile Management Group. And I get to work with Tracy every year on fall flavors, among many other projects. So I'll pass it along to her capable hands.
Thanks, Kent, and welcome back to our Wednesday webinars. This is our third edition. I think we missed last Wednesday. We've been doing these over the last couple of weeks. We really started when we were talking about opening. So now we're actually at the point where we are open. June 1st has come and gone. So it's quite timely for us to be having this discussion. I'd like to introduce my panel with me today. It's a very esteemed panel. I have Ryan Neal, who is the Manager of Environmental Health. Welcome, Ryan. Also joining us is Kent Scales, and Kent Scales is the PEI representative for Restaurants Canada. And finally, last but not least, certainly is Tim McRoberts, and he is a director at Canada's Smartest Kitchen. So thank you all for joining us today. I know everybody's really busy with things getting opened up, so thank you for coming to share your knowledge with the industry today. So Ryan, I'm going to start with you. There's a couple of guidance documents that are currently out there. We've seen the Restaurants Canada guidance document as well as the Food Premise Guideline. I'm wondering if you could just speak to why there's two documents and perhaps what the uses of each are.
Sure. Thanks, Tracy. Well, first, I just want to thank you for inviting me to the webinar today. Recognize this is a challenging time for all food premises and everybody really during this pandemic. But the guidance documents, together with all our staff here, are designed to support everybody through these challenging times. And we may not have all the answers, and I may not have all the answers on this webinar, but we're certainly willing to listen and to work with everyone in order to to make this transition into reopening or opening in-room dining as seamless as possible and as safe as possible for your staff and your customers. So in saying that, we have two documents available to food premises operators or restaurant operators right now. The first, I think I can share my screen here now. That's okay, Tracy?
Yep, perfect.
Okay, can you see my screen there now?
Can.
Okay, I'm gonna have to move this. All right, so the first document we have here, I was fortunate enough to work with Restaurants Canada, Luc Urjevec and Kent Scales and a number of other folks on this document, and we were happy to be able to provide our kind of PEI specific information. And you can see in the table of contents here, it really follows along with our preventative measures or public health measures that we have in place here in PEI, which I'll speak to shortly. But the reason I wanted to point out this document, which I understand is actually available to everyone, not just members of Restaurants Canada, but there's information in here that's in addition to the public health measures that are required or the guidance. Things like some additional food safety information, marketing, financial planning, and some training information as well. So I just wanted to bring this to everyone's attention that this document is here as well. And there's a link to it at the end of our provincial guidance document. So I think now what I can do is just turn over to our provincial guidance.
Yeah.
And this information was developed by the Chief Public Health Office with with environmental health staff involved in reviewing and and trying to make it as intuitive as possible, user-friendly for everyone to be able to apply to their specific types of businesses. So I'm going to just take a stab at pointing a few things out from this information. This is available on the Renew PEI website. So if anyone doesn't have access to it at this point, you can just Google Renew PEI and that will bring you to a site where you'll be able to see the public health measures, and food premise guidance is one of those. So, as I said, I just want to go through a few points. Now, the first section here has a lot of important points in it, so I will spend a bit of time on this first section. And one of the biggest decisions that we had to make was around the number of people that we wanted to have in food premises, and that's important because once you have a large group of people together, it becomes very difficult to do any kind of contact tracing if a person was ever to come down with COVID-19 symptoms. So by limiting numbers in a food premises, we are better able to respond if there are cases of COVID-19. And be able to do that contact tracing. So as you can see here, the maximum indoor seating capacity for food premises is up to 50 patrons. And at this point in time, there is no set seating capacity for outdoor dining areas, so for patios. And the maximum number of patrons at a table is 6. And with these maximum numbers, especially the 50 patrons in the establishment, we always have to keep in mind that the fundamental requirement here is physical distancing. You can have up to 50 patrons as long as there is physical distancing happening. And when I say physical distancing in this situation, it's between tables. So if I'm at a table of 6 people and there's another table of 6 beside me, the 2 closest people from those separate tables must be at least 6 feet apart. Okay, so keeping those tables separated and also keeping in mind that people are going to have to walk between tables potentially to get to a washroom, or serving staff would have to use those areas as well. So as much room between tables as possible is always good, but at least 6 feet between people at different tables, okay? And people who are sitting at the same table, they don't have to be 6 feet apart, but you certainly want to try to provide as much room as possible, because of course physical distancing is one of our most important control measures for preventing the spread of this virus. So it's still very important, and we are taking a risk with allowing up to 6 people from different households to sit at one table. But we have to put some responsibility on the public as well. They have to be comfortable with this situation and sitting at a table with other people. And of course, restaurants and their staff have a responsibility to make those environments as safe as possible with some of the other measures I'll talk about here shortly. Okay.
Ryan,
So yep.
In relation to a bar, so if there's 6 people able to sit at a table, what would be the circumstance of having 6 people at a bar? How would that look? Is that the same, or what? How does?
Yeah. So if just this bottom point right here, customers in a restaurant, dining room, or other licensed premises are required to remain seated for service. So we certainly don't want to see people gathering at a bar, but if there are bar stools being used, those bar stools really should be 6 feet apart. We would want to see the distancing, the physical distancing requirement there. We certainly are taking, you know, or a bit of a different approach with the tables, but the idea here, and later in the guidance document, you'll see that 6 feet between bar stools is what we're looking for there.
Thank you.
Another important point, two more important points from this section I wanted to point out. Recreational activities within food premises are not allowed at this time. So, and that generally speaks to the sharing of certain things. So, pool tables and equipment. Now that's something we're looking at a little closer because we do have some pool halls that are out there as well. But things like dance floors, video lottery terminals, kids play areas, and karaoke are things that we just want to see, you know, prevented right now from happening. But when we approach phase 4, or when we get into phase 4, there may be some relaxing of some of those requirements. And entertainment should be limited to one designated singer or instrumentalist. And there has to be 12 feet of distance from that singer to the next closest person. And that 12-foot distance instead of 6 has to do with what happens when a person is singing. When you have that singing occurring, evidence shows that the virus in droplets can be projected further than the 6 feet. So that's why we're looking for 12 feet. And the same applies in, you know, when there's going to be singing in churches and other places like that. So that's an important one there. So a food premises can have one person with an instrument, you know, playing during dining hours, as long as that person is 12 feet away from the next closest person. The next section here, preventative measures. I mean, these are the measures that are indicated throughout all phases of Renew PEI and in all of our guidance documents. So just basic things that I think everyone has probably heard to this point, but you know, physical distancing, preventing employees who are required to self-isolate from being in the workplace, having an illness exclusion policy so that if you have staff that are sick, they know that as part of their guidance they should not be coming to work, and that's also part of your policy. Enhanced cleaning and disinfection of commonly touched surfaces, and probably, you know, one of the most important points is having access to hand washing stations or hand sanitizing stations, because you know, the #1 way to prevent the spread of any illness is proper hand washing. So that's a really important point. Okay. Now in this general consideration section, there's a lot of good information here, but I believe most of it is fairly straightforward. So I just want to skip down to this section here on work activities and physical distancing, because we've had some questions on this already. And if work activities are happening and physical distancing cannot be maintained, we have guidance around the use of masks, non-medical masks. And if you are consistently within 6 feet of other employees, if your workstation, for instance, is within 6 feet of another employee's, you need to consider some kind of barrier. You could do something like plexiglass or some other type of barrier between you, or you can use a non-medical face masks. But we do want to ensure that if you are using face masks, that it's safe to do so. So that might require a conversation with our inspectors, or Occupational Health and Safety, Workers' Compensation Board would be able to answer some of those questions as well. And just to my point on hand washing, you know, if you can get your staff and your customers to hand wash or hand sanitize as they're entering the premises, you'll be doing a lot to prevent the introduction of not only the coronavirus, but also other viruses and bacteria that people might be carrying on their hands. So very important to have something available like that for customers and your staff as they come in to work.
Ryan, just one question on that. When we are using plexiglass barriers, is there certain sizes that need to be used? What are is there any guidance around that in terms of how large they need to be?
So what we would want to see is something in your operational plan that kind of explains what the scenario is around, for instance, workstations or booths, for instance. And we just want to take a reasonable approach to how we separate people out. We would certainly want to see, for instance, in booths, that barrier between the two booths up at least a couple of feet over a person's head. We don't necessarily have specific guidelines around that because it's challenging to consider all the situations, but we're more than happy to provide some guidance if there are questions around that in terms of the size of that plexiglass. I can say certainly that it would need to be part of your cleaning schedule, and whether it's between two employees or between customers in a booth, it definitely has to be cleaned and sanitized just like other surfaces in the facility.
Thank you.
Yep. And then another important point here is to provide signage and guidance to patrons regarding a lot of the things that I just mentioned around hand washing, physical distancing, if they're symptomatic, not to enter the premises. So it's important that you make those policies very clear for everyone who's entering, so that you can avoid having an interaction with somebody who may enter and not be aware that they shouldn't be there for one reason or another. So those are just some general considerations. Now I'll just get into some of the some points around table service and just a little bit of information about in the kitchens. So around table service, what I want to point out here is that reservations are encouraged for in-room dining. And that directly relates to the next point here, where we ask that food premises record at minimum the name, contact number, and number of people seated at that table for every dining party that comes in. And obviously the reason for this is twofold, really. And this should be brought to the attention of your customers if they have concerns with giving you this information. It's really there, this requirement is really there for public health to be able to do contact tracing if a member of that dining party ever became ill and as part of the tracing determined that they ate at your establishment. But it's also to protect your staff and that customer in the event that your staff develop symptoms and we need to make an announcement that there was a case or anything like that at a particular premises. Hopefully that never happens, but this is one that I know is going to be challenging for a number of different food premises. The ones taking reservations won't be as difficult because that's generally information you would collect when you when someone makes a reservation. But some of the fast food premises, it will be challenging for them, and we understand that, and we're willing to work with them to try and make this work. And let's see, last section here. Yes, there is. Just trying to limit as much as possible any, the interaction between staff and customers. Of course, there's going to be some interaction at the table when serving staff are providing that service or bringing food to the table. I've heard some operators indicate that they plan to have maybe a runner who would constantly be donning a mask and would just be bringing food to tables. And while that person is delivering food, the server may be there to speak to the customers or something like that. But But that ability for a waitress or another serving staff to be able to be taking a mask on and off actually presents its own risks, because there's certain procedures around putting a mask on and taking a mask off. So having a person designated to bring food to tables is a way that you might be able to avoid some of that. Around cleaning and hygiene for just the kind of front of house, down below here is an important point, but I'll mention it first, and that's to ensure that you develop a new cleaning schedule and assign and train staff as to what their responsibilities are going to be. There has to be some accountability, on your staff that are responsible for cleaning and sanitizing, because it clearly is one of the more important points, in terms of cleaning and disinfecting frequently touched surfaces, and eliminating that risk for your staff and your customers. So it's really important that be in place. Some of the other important points there, just around some commonly touched surfaces, tables, the backs of chairs, laminated menus. Those are all frequently touched surfaces, and I'll touch a little bit more on washrooms later, but those are all surfaces that need to be identified in your sanitation plan or your cleaning schedule, so that it's very clear to staff, not only that they are important areas to be cleaned, but also in your operational plan, it should identify what chemicals or what cleaning agents are used to complete those jobs, how to mix those products, and the frequency at which they need to be cleaned and sanitized. So those are some important points that need to be in that cleaning schedule in order to give your staff the guidance that they need to do that job properly. And then around bathrooms, physical distancing is going to be important in washrooms, and maybe you can only allow one person in at a time, but with signage indicating that on the door. But also cleaning and sanitizing is important there as well. And this is one we've certainly had some questions on, like how often does it need to be cleaned and sanitized? And the easy answer for us is just as frequently as possible. But generally speaking, I would tell premises, whether it's a food premises or a different type of business, at least several times a day. And typically I say a couple of times in the morning, a couple of times in the afternoon would certainly probably be more than you're typically used to doing. So we would consider that an enhanced cleaning schedule. So just those couple of times. And if you're open through the evening, then maybe a couple of times through the evening as well. And it's not going to hurt for customers to see that kind of activity taking place. It's going to reassure them that food premises are taking their responsibility to provide a safe environment very seriously, and they're going to be more comfortable in returning to your premises. So just some points there around cleaning. The other points in there I think are fairly straightforward, so I won't go through every one. Then in the kitchen, yeah.
Could you just quickly touch on one of the questions we've had is the difference between cleaning and disinfecting?
Sure, absolutely.
That seems to come up a few. Yeah.
Yeah, so there definitely is a difference between cleaning and sanitizing and disinfecting. And cleaning is always required before sanitizing and disinfecting, because the cleaning step actually removes visible dirt and soil from the surface. So the detergent loosens that material up, lifts it off as you wipe it away. And that leaves the surface free for a proper sanitizing or disinfecting. And sanitizing and disinfecting are very similar, only with disinfecting, you're typically using a higher strength or a stronger chemical mixture to achieve a higher kind of kill rate, so to speak, for that surface. And for disinfecting, that's something you might do in washrooms and non-food contact surfaces. And there's generally, depending on the chemical you're using, we want to see approved chemicals with a drug identification or DIN number for your sanitizing and disinfecting, and there's normally instructions on proper mixing for those. So that's the difference between cleaning and sanitizing and disinfecting. And it's also important to know that if you have food contact surfaces, we want to see those sanitized. So you would follow your typical guidance that we've always provided to you in terms of sanitizing. Because if you use a chemical or a disinfectant, a too strong a mixture, then it could present a risk. It could be transferred onto that food. So that's why we try to use just sanitizing concentrations for food contact surfaces. Okay, physical distancing. So this is kind of has to do with the kitchen. Again, I think a lot of things are fairly straightforward in this section, but I had highlighted here the need for physical distancing in kitchen spaces, and we recognize how challenging this is in the different types of kitchens that we see, whether it's quick service restaurants or other types of dining facilities. And it's important, the way we look at this with physical distancing is ideally you would have workstations set up so that people can have their workstation at least 6 feet away from another. But if your staff have to consistently work closer than 6 feet, that's where we would strongly consider or strongly recommend that you consider like physical barriers or the use of non-medical face masks. Again, ensuring that those are safe to use in the various scenarios or situations where your staff are working. So, always important to remember that, we're trying to work with the public coming in your premises and physical distancing as much as possible or as much space as possible between guests, but we have to carry on that same principle into the kitchen and try and ensure that our own staff are meeting that requirement as well. This point here regarding restricting access into the food preparation area, if possible, you want to arrange for, any work that serving staff might have to do. If they don't have to be in the kitchen to do that, and they can have a workstation set up in a different part of the space, that would limit the number of people in your kitchen and therefore make it much easier for physical distancing. So that's something to consider. And also in regard to delivery persons who are coming into the establishment, if you can limit their access to the spaces where you're handling food and preparing food and where you already have potential challenges with physical distancing, then you should try to do that as well. So some other points there that I will leave for folks to look at. And just a couple of sections left here quickly. I'm probably approaching my time, but in terms of cleaning and hygiene in the kitchen, I think I spoke enough in regard to the cleaning, sanitizing, and disinfecting and what the differences are there. But the important thing with cleaning and hygiene in the kitchen is generally following your normal procedures for your normal use of cleaners and sanitizers, but just enhancing that frequency at which you're actually doing that work. And if you just stand back and watch your kitchen staff, how often they touch oven handles and door handles, coolers and shared equipment, knives and things like that. Those are the touch points that we want to make sure are being addressed in your operational plan and in your cleaning schedule, to make sure that we minimize as much as possible how many people are sharing spaces or sharing equipment. And one example that we mentioned in this document is, if people have their own equipment, oftentimes cooks or chefs will have their own set of knives and other types of equipment like that, and if they can be encouraged to use those and to clean and sanitize their own equipment, then that limits the need for all that shared equipment. So, and then just a few points on delivery. Most food premises have been operating, prior to June 1st on a virtual order or phone-in order and delivery system. So, you know, I've spoke to a number of those, and they certainly have put the necessary protocols in place to ensure the safety of their staff and delivery people, as well as the customers that they're delivering to. So just a little bit more information there about you know, some shared spaces, or if there's shared vehicles between delivery people, that you know, your cleaning protocol, your disinfecting protocol should carry out into that type of environment as well, just to protect those folks. And those folks are typically coming into your establishment as well. So including that in your cleaning and sanitation plan will help protect everybody. I think that's all I was going to say on this. Now, as you can see, I might have passed it here. The Restaurants Canada, the link to the Restaurants Canada document is there. So, you know, again, I would encourage people to have a look at that document as well, as it addresses a few more things than ours that restaurant operators might be looking to have access to. Okay.
Excellent. Well, thank you very much, Ryan. We really appreciate your joining us today. Ryan's going to stick around for some questions at the end. So if you do have questions, now is the time to get them in, and we'd be happy to direct them to any of our panelists. We have a lot of chefs with us today. That seems to be the bulk of the people that we have on the call with, or on the video call with us today. So certainly get those in, and we'll try to get those answered. So I'm going to go over to Kent now. Kent's the PEI representative with Restaurants Canada. You've been doing a lot of work over the last couple of months, obviously creating some guidance documents for the industry. Ryan touched on those documents, but perhaps you can just give us a little bit of insight as to why people would want to dig a little bit deeper into those documents and what might they expect to find.
Sure. Thank you very much, Tracy. And I just joined the Restaurants Canada board probably around the 1st of March, and so then obviously kind of jumped into this. But in the Restaurants document, Restaurants Canada document, it goes a bit deeper into some marketing ideas and how to do financial planning. So it talks about the importance of you know, social media marketing properly. Website, you know, customer service. So it goes into a little more detail in that aspect. And then I guess it was probably, I don't know, Ryan, probably 5 or 6 weeks ago, we started working pretty close together and developing some of the guidelines that had to be put in place for the industry. And working together, you know, I think we came together and developed a pretty good document that was workable for most operators. And my take on it is that you know, there's always a bit of give and take. And if there was a situation, you know, Ryan and his department are willing to work with anybody and to come up with, you know, solutions that hopefully can work out for that particular restaurant.
Awesome. Now you have quite a few operations across Prince Edward Island. You're in the reopen phase. Can you talk to us perhaps about some of the challenges you faced, obviously to meet the guidelines, and perhaps some of the things you can put in place to overcome that?
Well, I guess, you know, the challenges is sort of the unknown, right? But these guidelines are put in place for a reason, right? And the more that we can adapt and adhere to these guidelines, the safer we are going to keep our customers and our staff. And, you know, going forward, we don't have any, to our knowledge, we don't have any cases on PEI, and we want to keep it that way. So it's important that we continue to follow the rules. And, you know, perhaps in time, some of the restrictions possibly might be able to be eased. But once again, we're at a starting point and we have to sort of go forward. In terms of ourselves, I mean, some of the challenges would have been, you know, just on the capacity side. I think for most operators, we can live within the maximum of 50 and physical distancing. but it meant reconfiguring your establishment, so removing tables and things such as that. And as Ryan had mentioned, putting up barriers or plexiglass between booths. I've been into a few restaurants just the last few days just to see how they're getting along, and you'll see arrows on the floor now as to just how to walk in, but I think for the most part everybody's doing a good job. Some of the smaller restaurants would have a bit of a challenge because they're just limited in the number of seats that they can have to do the physical distancing. But they're doing their part to try and figure out a solution to, I say, maximize capacity and stay within the guidelines.
Awesome. And any problems getting staff to come back to work? Anything in, obviously now that we're open, people have been home. Any issues there? Has that been successful?
Yeah, I guess no. The staff are, in our case, and I think from a lot of operators, that it's been pretty good. I know there's some government programs that on the federal side that make it it's kind of attractive to stay at home, but I think for the most part, in our case, workers are willing to come back. I've been asked from the customer point of view, is it safe? Well, I would probably say it's probably safer now with all the cleaning measures. Like we have, most places have identified almost like a COVID manager to put in to implement the guidelines. And they've designated staff to go around and doing the sanitizing and disinfecting and so forth. So, in terms of establishments, I think they're clean and they're safe, and as long as people follow the guidelines, we should be okay.
Excellent. Tim, you've been working at putting these guidelines in place at CSK. Similar question as Kent, sort of what challenges have you guys faced? Any creative solutions you guys have come up with to kind of work within the guidelines, but to make sure that they work within your facility?
Sure. Yeah. Thanks, Tracy. And to start, similar to Kent and Ryan, we want to thank you for having us being a part of this today. This is an excellent support series, and the timing is great because actually this is the week that the CSK R&D chefs have returned. So a lot of the things that we put in place we're seeing them in action. So it's exciting. One of the most valuable activities that we took on was including the staff in the process when we were preparing to reopen. We sought their input, and we actually assembled a working group with some of the individuals on our team just to pull ideas together. We blended this into guidelines and operational directives being implemented across the college, and that it was a really good way for us to get everybody involved and create the dialogue that's really important as you're working through this. Certainly some challenges that we faced, and we feel that we have a good plan in place to overcome them, although things will obviously evolve as we move forward. But spaces are tight, similar to here at CSK, like many other restaurants. The fact that kitchens are very active spaces creates an interesting set of challenges as people are trying to do their work. Face-to-face meetings, whether it's of staff, whether it's with patrons, whether it's like whoever you want to talk with, we came up with solutions there. Shared spaces, even as simple as offices that maybe two people would have been working out of before. So, coming up with solutions there. And then, of course, deliveries, being really clear about that. And, as Ryan was going through many of the points there, you can see them alive once your operational plan comes into place. But deliveries was an interesting one. So, in working with the college, we have here at CSK a lot of yield zones, and really what they allow us to do is to let the staff give way to other staff as they're moving around, because we simply don't have space for whether it's two-way traffic, one-way traffic, that kind of idea. So we have a series of yield zones throughout the facility where if somebody is coming down a hallway, somebody can pull off to the side, let them pass, maintain the physical distancing, and then carry on your way. So that's been interesting to develop, but we have it in place. And those are clearly marked, as we heard about, with markings on the floors and signage on the walls and things like that. So in another thing that we did here, especially in the kitchens, is we created work zones in the kitchens. So instead of that idea of just simply going in and setting up a cutting board wherever you feel it's convenient for your particular day, we now actually have work zones identified in the kitchen spaces, and we created a schedule to post as to when the staff can go to those zones and do their work. And the whole reason behind that strategy was to ensure that in the kitchen, we can maintain this opportunity for people to yield and give way and maintain physical distancing as people go throughout their day. Because as everybody, as I'm sure on the panel and who's listening understands, kitchens are very mobile, and you're off to the walk-in, you're off to the dishwashing area, you're off to get equipment, that kind of idea. So these zones help us to manage that really well. A couple of other things quickly that we did is we did find a couple of new locations on site for staff to set up an office. And yes, it's a temporary measure right now, but it does allow us to give everybody a respectful place to work. With the team approach that we put into place at CSK, it's amazing as to how flexible people are and how willing people have been to work on. It may not be perfect, but it's going to get us to where we need to be, and we'll adjust as we move forward. Lots of virtual meetings where need be at CSK. But then the other thing that we did here to get to this place today so that the staff can be here is we ran several scenarios really replicating how we operate at CSK. And in running those scenarios, walking through with an imaginary delivery arriving, or walking through to do a new prototype that needs the deep fryer, whatever that is, there were so many instances where you just kind of looked around and said, that is not going to work. So we would then go back to the drawing board and come up with a new plan. And we finally got to a place where we realized, okay, this will now work. So that was an important piece for us to get through some challenges. Two real other quick points is we made it a point of bringing the staff back in small groups when the plan was in place so that we could walk them through it really closely and spend the time and talk about why things look like the way they do and all that kind of stuff. I just knew that bringing back 5, 6, 9 people, whatever it is, you just can't get that level of detail in the conversation. So we actually staggered the times that staff could come back, and we took groups of 2 and 3 around and walked them through and answered questions. And then the last point I'll make about some of the challenges we overcame is we have instituted version tracking for our operational plan, because we want to make sure that our plan is going to change over time, and we always want to make sure that we're working with the most up-to-date operational plan, so we all know which version we're working with. We'll make a change, institute a new version, and go from there, so that everybody understands this is the most up-to-date version of the operational plan. And we make it public as well. The plan is sitting in paper copy along with our electronic files, but right on the front desk of CSK. So any staff member can go back and review what was that little detail that was there. So
Awesome.
Hopefully that helps a little bit.
Excellent. This is a question, and Ryan, you can chime in if you've heard any, but I guess one of the questions we have, I'm going to direct it to you to start, Kent, is when an employee shows up for work and if they indicate they have symptoms and they have to go home, is that employee paid for that day? How do you deal with that if an employee has to go home because of illness? If they're, displaying symptoms.
Good question. Never thought of that one.
I really want to know this.
Pardon me?
I really want to know this.
Sure you do. In our case, most of our staff are paid hourly, and if that were the case, most likely they would not be paid.
Tim, that probably.
I can add to that too. And that's, in terms of being symptomatic, I think it's important for staff to be, advised through an illness exclusion policy that, that they're aware if they do have symptoms, that they shouldn't even come to the workplace. And as Kent mentioned, we know it's challenging for food premises who have hourly staff who may not have access to sick days and and things like that. So, or benefits like that. So we know there's a challenge there, and that's always been a challenge in the food service industry. But having those policies in place so that, and having your employees trained in what those policies are going to prevent that person from entering the workplace and potentially exposing the rest of your staff. Because the worst thing you could have happen is have a symptomatic staff come into your workplace, be working in the kitchen with, half of your other employees, and then potentially to lose that full, or half of your staff complement, which I would assume would cripple a food premises in terms of ability to maintain the necessary operations to serve their customers. So having that exclusion policy in place, ensuring your staff know, having signage available that reminds staff that if they are symptomatic, they should not be at work, will go a long way, I think, in preventing someone with symptoms from coming into the kitchen.
Thanks, Ryan. The other question we have here is Ryan, this is for you. It's a clarification on the bar stool question. I'm going to try to get this across as best I can. Can a couple, so I'm assuming a couple being in the same family is what I'm assuming people are asking, sit beside each other in bar stools as long as the next guest is 2 meters away from them? So I'm assuming, can they sit side by each, and then as long as the customer is meters away? Yeah,
I anticipated a question on this. And the answer is yes. I mean, anyone who's been following Dr. Morrison's press conferences know that, people in the same household are treated somewhat differently than people from different households. Of course, because they are considered close contacts already because they live together. So in that situation, yes, they could sit closer than the 6 feet. But, in terms of setting your bar stools up at the bar, that's where we would recommend having them separated so that people from different households, are not necessarily, who don't know each other, are getting within that 6 foot distance. And of course, we've heard lots of concerns from the public around, why would we allow food premises to have seating with people from different households when physical distancing is so important. There's a couple of points I try to make there. I mean, of course, we would encourage families to dine together, households, so to speak, to dine together, which reduces the risk. But the public has some responsibility as well with, to make a decision about who I'm going out to dine with. Is that a trusted individual? Do I know they're not symptomatic? Do I know they haven't been outside of the province in the last 14 days? Am I comfortable with their hand hygiene practices and things like that? You have to be comfortable with that person you're sitting beside. So there is some responsibility on that, on people as well to do that. And is it a risk? Absolutely. But we do have to start somewhere. And this seemed like a reasonable approach, given all of the other preventative measures that all of our diligent operators would, we hope will put in place.
Thank you. Tim, I have another question for you in relation. You and I spoke the other day a little bit about mental health and certainly some of the issues that have, are starting to arise, obviously around safety and all these new guidelines and the pressure that it puts on some of the staff. I guess I'm wondering if you could speak a little bit to that and perhaps how you're dealing with that particular situation.
Sure. Yeah. No, thanks, Tracy. And I think that's a really important point to discuss. And what I've been doing is challenging myself over the last while to be aware of how the pandemic and working from home, planning to return, now returning to work, all of those activities carry different levels of anxiety for different people. And you can really start to see it when you're having those conversations with groups and individuals and you're at home or you're on the street, all that kind of idea. So, I think that awareness is really, really key. The word mindfulness keeps coming to me about that, and just being mindful that this is a very important thing to consider about staff returning and what this means to their families and all of those kinds of things. So to address that and to be aware of that, some of the things that I've challenged myself to do is make sure to ask a team or your group that you work with, or the larger group that you interact with, ask them for input and get their opinion and hopefully build some buy-in into the process and see how they're doing. It's been incredible to see, and I'll use the example of Canada's Smartest Kitchen here, to see what the team has brought forward as potential solutions based on guidelines has been just fantastic. And there is no way I could have done it all on my own, sitting here in an office, just putting plans in place. It needed to be a team effort. So that was really, really important. I'm sure the group here has heard it a lot, but really sincerely thanking people for their input and making sure that you're checking in with them frequently and being sure that people know of the supports that are available. These are all really important things to consider, because it is very difficult to measure that level of anxiety that somebody is feeling, and what potentially you might assume it looks like on the outside could be very different than how it truly is on the inside. So those kinds of things have been important. We're very fortunate to be a part of Holland College, because our employees have excellent supports to an employee and family assistance program, and the college has made an excellent making sure that staff know that those services are aware or are available to them. So that's been really good. But you realize too that not everybody has that opportunity. So making sure that people are aware of the other kinds of supports is really key. So I would suggest listen to staff concerns in earnest and really make a point of being an active listener when somebody comes with an issue that they're facing or a concern that they want to bring forward. Make sure to follow up with them, because we all don't have the answers. And I certainly know as we're getting ready to open here at CSK, things have changed quite a bit. So follow up with them, don't leave things hanging, and then look for solutions collaboratively. A lot of people, they have the answer, they just need some help in getting it out and work through it there. So again, it kind of comes back to that communication and working together as a team. So I think in doing that and making sure that staff know they have an opportunity to come to you and that you are going to listen and respond is very important as people are considering coming back to work.
Thanks. And it's quite apparent that everybody's dealing with things differently.
Mm.
Go through this pandemic, everybody's dealing with it in a different way and has different stresses. So everybody's quite unique. So I'm getting ready to wrap this up. I'm going to call for a last, request for questions if anyone has them. This is a great panel. This is a great chance to, I think one just came in. Ryan, are you expecting, I know you covered this in the last webinar, are you expecting to receive a flood of 1,200 operation plans?
Well, we did receive a lot of operational plans, but we tried to communicate from the start. And to go back to kind of the start of when the pandemic hit and we were looking at how we get people, our premises reopened, we certainly considered asking workplaces to submit their operational plans. But we quickly realized that this goes beyond food premises. It really hits every workplace in the province. And even with WCB's support, we could never be able to review all of the operational plans out there. So, we tried through things like this guidance and the general preventative measures that Dr. Morrison has spoken to since the beginning of the pandemic. We try to make that information available to empower operators to come up with their own operational plan the best that they can, and have that in a written format on site. And when we visit to inspect, which we've started doing now, we've started doing our routine food premises inspections as well as this COVID inspection. We're going to be there to work with operators. It's we know how challenging it's been just to get operational again, to get your staff back, to take the steps you need to take to make it a safe workplace and safe for your customers. So, we're not going to put another layer of challenges on that in terms of heavy enforcement. We certainly are going to require every operator to take the necessary steps to protect people, but we're clearly and more than willing to work with everybody to get that plan where it needs to be. And you know, the conversations I've had to date have, you know, I shouldn't say that they've surprised me, because many of our operators are very diligent in protecting their staff and their customers, but I've certainly heard lots of you know, very nervous operators. They want to do things right. You know, it's not like they're trying to circumvent the system or find loopholes. They want to do this right, and we're very happy to hear that, and that makes us want to work with people rather than you know, a heavy enforcement type model. So yeah, so we're here to work with everyone.
Thank you. I have another question that's come in. I believe it's from an accommodations operator. They have a community weekly coffee and snacks that they do with some of their community members. So this is a community operation, sorry. Weekly they give out coffee and snacks. Those coffee and snacks come from a registered kitchen. And sometimes guests are bringing in their own snacks. Can this continue? Is there a way that if all the snacks come out of the registered kitchen that this could work? So it sounds a little bit almost like a buff. It might be.
Yeah. So yeah, that's a good point. I mean, the first thing is some of our accommodation operators actually also have a food premises license. And so if they have a food premises license, they would fall under this guidance that I just talked about. And they would be able to serve foods that are from approved sources. You know, albeit some of the things you just mentioned may be considered low risk type foods in terms of transmitting pathogens or disease causing microbes to the people who are consuming it. We want to see in a food premises only food served from approved sources, and that would be other places that are inspected. And to touch on the buffet point, you know, if sandwich trays and things are laid out, that's something we don't want to see right now. You know, not sure what phase 4 will look like, but we definitely want to move away from the buffet style, the open food on the table. You know, people being able to touch, even if they went for one sandwich, they could touch several others in the process. So that's something we would prefer not to see at this point in time. And then if this isn't a premises that has a food premise license, then the gathering guidance document would apply here. So under the Renew PEI website, there's also guidance on gatherings indoors and outdoors. And the numbers are a little different. You know, indoors, it's a household plus up to 15 other non-household members, or outdoors, it would be up to 20. So that's the guidance they would follow if they don't have a food premises license.
So if we were serving individually wrapped cookies that were prepared in a registered kitchen and putting them out, would that work?
Yep, that would work. I mean, I think that falls in line with the guidance that we have out there. You know, and of course you want a trusted facility that you're purchasing these products from, that you know has good food handling practices, and there shouldn't be a concern with that.
But they could not come from the community wrapped to be served. They would have to have been prepared in the registered kitchen, correct?
Yeah, at this point in time, because we are clearly in a pandemic, and you know, having volunteers, this is an issue we deal with on a regular basis. Because of the good nature of Islanders, they want to volunteer. They want to provide you know, food to events like you're referring to. But when we have people who are not necessarily following the guidance out there in their home kitchens, we would prefer to see, them not preparing food in those kitchens to bring to a communal type event like that. So at this point in time, we would certainly want to see those only coming from an approved source.
Excellent. Well, thank you very much, folks. That pretty much brings us to 4 o'clock, and I think we've answered all of the questions that we have. I know there's tons of resources out there for people to get further answers to the questions they have through the guidance documents of Restaurants Canada, through the Renew PEI site. I know Food Island Partnership, Kent's probably going to reference that as well, but there's tons of resources out there for people. And I think even after this, if more questions come in, we're happy to filter those through to public health and get people the answers that they need. So thank you very much for your time today. I know you guys are all busy. Good luck with your reopens and all of the new guidance document or guidelines that are being implemented, Ryan. Appreciate your time, and with that, I'm going to throw it back over to Kent.
Yeah, I'd echo that, Tracy. A huge thank you to all our panelists today, and a huge thank you to Tracy for moderating our webinars so far. I think that's a huge help, because I think it's, you look through guidelines and then try to look at what's it mean for my restaurant or my food space, and how do I make it all work there. So as Tracy mentioned, the guidelines are on the environmental health site. I was searching through, there's guidelines for a lot of things. So we've also included them on the foodislandpei.ca website. And we have a dedicated email now. If you have any questions, just email reopen@foodislandpei.ca, and then we'll respond. And what that helps do is a liaison to the environmental health, so that Ryan's not bombarded with emails, that he can sit down with one of our staff, as a daily or every couple of days, and answer all of those questions and go through. So we're here to help, and if it is beyond a reopen, and if you've got a new food idea, we're always here to help as well. I'm sure Tim will be excited to work on it, Canada's Smartest Kitchen, and hopefully it'll be on a restaurant menu with Kent in the near future. So again, a huge thank you, and have a great day.
Thank you.
You.
Thank you.